You and I have discussed in the office the possibility of needing surgery, and you agreed to go ahead with that. And so I just wanted to make you more comfortable about the surgical procedure and what you should expect. Number one, we're going to talk to you about the complications of surgery and have you sign out informed consent for both myself and my PA, Jim Alvarez, who's been with me for 17 years, and we do all the cases together. The risks associated with surgery can be significant. We're doing sports medicine and arthroscopic surgery, so the risks are much lower. But there can be issues associated with infection, bleeding, and anesthetic complications. It can go all the way down to risk of life, but that really doesn't happen, and it has never happened to me. But just undergoing anesthesia in itself is inherently risky. As far as what the risk profile is for my kind of procedures, it really is only infection, and we really don't have many infections. So if I put a percentage on it, it's 0.2%. So not a high risk, but something you want to consider, especially because a lot of these are elective surgical procedures. If you have heart issues, if you have medical problems, if you have significant amount of medications, or if you're overweight, we sometimes would think about it and discuss extensively what the complications would be, because we don't want to put you in a position where you're going to get harmed by this. We want to weigh the risk-benefit ratio and make sure we're doing the right thing for you. As far as the surgical process, after we decide to perform the surgery, my staff will then tell you exactly what you have to do preoperatively, when you should stop the anti-inflammatory medications because they do cause bleeding, what medications you need to hold, the fact that prior to the surgery you have to not eat after midnight. That is all for your safety and to make sure that you don't have an anesthetic complication associated with it. They'll also tell you about HIPAA that you need to get at the pharmacy to wash yourself off so that we don't get any complications associated with this. We also want you to try and be healthy because we want you coming into the OR in a healthy, active way. That means that we don't want you to drink alcohol for the few days ahead of the surgical procedure, and try and get a good night's sleep, although most of you come in tired because you're, number one, not able to have coffee in the morning, and your husband or wife is there drinking it, so you're angry about it. But also because you're just nervous about the procedure. We'll do everything we can to make you comfortable with that. You also have to get a pre-op physical with your medical doctor. Usually they're very good about doing that and taking care of it for us, but if not, and you're young and healthy, we can sometimes do that for you at the surgical center. As far as the pain control postoperatively, we do give you narcotics. As you know, there's a national epidemic of drug addiction, and we do not want you to be a statistic. So while we want you on the narcotics for a short period of time, we want you off of them as soon as possible. Because we want to decrease the number of narcotics you use, we often do blocks. The blocks are oftentimes with Exparel, which is a long-acting liposomal bupivacaine, so it can control some symptoms up to 2 to 3 days, and that would therefore decrease your narcotics. We also give you cryo cuffs, depending on how extensive the surgical procedure was, and that basically circulates fluid through, cooling down the joint and increasing the pressure on the joint so it decreases swelling and therefore decreases your narcotic requirements. We also will have you take other medications instead of just the narcotics, anti-inflammatories, sometimes muscle relaxers, anything we can do to decrease the amount of narcotics you take. If you have issues with the narcotics, talk to us ahead of time, because we want to make sure that we don't give you something that you're not capable of taking. If you have any issues preoperatively, make sure we address them as soon as possible, because it doesn't help us if you come into the surgical center with a problem and then we can't really help you. So sometimes we would have to cancel your case. As far as the postoperative regimen, we describe all of this to you in the OR, but we can also describe it ahead of the OR. Postoperatively, we want you to get on the narcotics and off of them as soon as possible. We want you to wear your brace, use the cryo machine so it decreases your swelling and decreases your narcotic requirements. We also give you ankle cuffs, leg cuffs. Basically, they're compressive devices with a battery that press on your legs. The reason that we do that is we want to decrease your risk of a blood clot. We don't have many blood clots, and I haven't had one in my career, but it helps to decrease the blood clot risk. Essentially, compressing the calf compresses the veins, and that helps pump the blood out of the leg, and then the valves are competent so the blood doesn't run down to the leg. It is that stasis of the blood that causes the blood clot. We will talk to you both pre-op and post-op with any questions you have, and we should get you an appointment immediately post-op at 7 to 10 days so that we can see you in the post-operative setting. Once again, if you have any questions about any of these in the office, feel free to ask us. This is just a general overview for you.